Picture this. You're just walking down the street, minding your own business, and bam, a cricket ball flies out of a stadium and hits you. Sounds like a total freak accident, right? But is it just bad luck, or is someone actually, legally, to blame? Let's get into it. You know, that cricket ball story, which is from a real court case, by the way, back in 1951, it cracks open this huge legal question. When does a simple act of carelessness cross the line and become legal negligence? That is exactly what we're going to break down here. This core idea in negligence law called breach of duty. And we're going to tackle this whole thing like an expanding riddle. First up, we'll meet the law's go-to yardstick, the reasonable person. Then we'll look at the four-part balancing act courts use to weigh just how careless someone was. After that, we'll see what happens when we raise the stakes for professionals, explore the massive shift toward a patient's right to know, and finally, see how it all clicks together in the law today. All right, so our first stop is the absolute foundation for figuring out if someone messed up, legally speaking. It's called the reasonable person test, and it's the law's way of trying to create one single objective benchmark for how we all should act. So what are we even talking about when we say breach of duty? Well, it's pretty simple, really. It happens when someone's behavior just falls short. It doesn't meet the minimum standard of care that the law expects from them in that situation. But that just leads to another question, right? What is that standard? Well, the answer comes from this classic definition, all the way back in 1856. It says, negligence is one of two things, either not doing something a reasonable person would have done, or doing something a reasonable person would have avoided. This simple idea pretty much created a new and very important character in the legal world. And who is this reasonable person? Well, they're not a superhero, they're not perfect, they're just an ordinary, sensible person. This is such a brilliant legal idea, and it's been updated over the years to keep it relevant. In the UK, it started as the Man on the Clapham Omnibus, and here in Malaysia, you might hear it called the Man at the Teh Tarik Stall. It's just a stand-in for the average, everyday citizen. Now, here's where it gets really interesting. This test is objective. It doesn't care about your personal skill level. In this famous case, a learner driver was judged by the exact same standard as any other competent driver. So the law doesn't give you a pass just because you're a beginner. The standard of care is fixed because it has to protect everyone else on the road. But okay, it's not always that black and white. To figure out what a reasonable person would actually do, courts don't just guess. They use a much more detailed approach, what I'm calling a four-part balancing act, to really weigh the situation. So when a court is trying to decide if someone was careless, they're going to look at these four factors. Think of it like a checklist for being reasonable. First, how big was the risk, really? Second, how easy would it have been to prevent? Third, was the action itself actually useful to society? And fourth, what does everybody else normally do? Okay, let's circle back to our cricket ball. This is the real case, Bolton versus Stone. The court looked at the probability. Sure, a ball could get hit out of the park, but it turned out it had only happened maybe 6 times in 30 years. The court decided that the risk was so tiny, so remote, that the club wasn't negligent for not building a ridiculously high fence. A reasonable person just doesn't guard against every tiny, bizarre risk out there. But, and this is a huge but, probability is only half of the story. The other half of magnitude of risk is the seriousness of the harm. So in this case, a mechanic already had only one good eye. The risk of a metal chip flying off was the same for every mechanic, sure. But for this specific guy, the consequence of that injury was absolutely catastrophic, total blindness. So the court said because the potential harm was so severe for him, his employer should have taken extra care and just given him the goggles. Next, the court asked a very practical question. What would it have actually taken to prevent the accident? In this case, a factory floor gets flooded and becomes super slippery. The owners did what they could. They spread sawdust everywhere. The only way to make it 100% safe would have been to shut the whole factory down, which the court said was just not a reasonable or practical thing to do. The law is only asking you to take reasonable steps, not to eliminate every single risk at any cost. And this quote brilliantly sums up the third factor, the social value or utility of the act. So here, a fireman got hurt because equipment wasn't properly secured in the truck. But why wasn't it secured? Because they were in a huge rush to save a woman's life. As the judge famously said, the goal of saving a life justifies taking risks that you'd never take in, say, a commercial delivery. It's all about balancing the risk against the reason you're taking it. Okay, so far, we've been talking about ordinary people. But what happens when the person involved has special skills? Like a doctor, an architect, an engineer? Well, the law is smart enough to know that the man at the tectonic stall is not the right yardstick anymore. The rules change. This is where the standard of care gets a major upgrade. A professional isn't judged against you or me, they're judged against another reasonably competent person in their same field. It makes sense, right? You expect your doctor to have the skills of a competent doctor. The law agrees. You have to meet the standard of your own profession. And that thinking leads us straight to one of the most important and, frankly, most controversial tests in medical law, the Bolam test. In a nutshell, it says a doctor is not negligent if they can show that a responsible group of other doctors would have done the same thing. So let's break that down. The Bolam test basically lets the medical profession police itself. A doctor doesn't have to be the best of the best, just competent. And as long as they can find one respected group of peers who supports their actions, they're probably in the clear, even if another group completely disagrees. For decades, this whole approach was basically summed up in 3 words: doctor knows best. And for a long, long time, that was the way it was. But then a really big shift started to happen. People started talking more about patient rights, about being able to make your own informed choices. And courts all over the world started to ask, is doctor knows best really fair when it comes to telling patients about the risks? This is where the story takes a really dramatic turn. You can see the whole evolution right here. For 35 years after 1957, Bolam was king. But then in 1992, an Australian case called Rogers v. Whittaker came along and completely changed the game. It said, hold on, the job of telling a patient about risks isn't just for doctors to decide. The courts get a say too. And that new patient-first way of thinking was officially adopted here in Malaysia in the huge 2007 case of Fu Fiona. So what is this new test? It flips the perspective. Now, a doctor has a duty to warn a patient about any material risk. And what makes a risk material? Well, it's any risk that a reasonable person in that patient's shoes would think is important to their decision. The focus shifts from what the medical community thinks is important to what the individual patient needs to know to make their own choice. So where does that leave us? Did the old Bolam test just get tossed in the trash? Well, not quite. The law has actually settled on a much more nuanced, kind of hybrid approach. It recognizes that different parts of a doctor's job need different standards. The standard in Malaysia today is this dual system. For all the technical stuff, the actual diagnosis and treatment, the Bolam test, where doctors are judged by their peers, still applies. But when it comes to advising a patient about risks, the law uses the patient-focused Rogers test. So you've got one standard for the medical skill and a totally different one for the communication. So when you look at it all, from a simple cricket ball accident to the incredible complexities of a surgeon's duty, the law of negligence is this constant, fascinating balancing act. It's weighing risk against precaution, public good against private action, and professional expertise against our right to control our own bodies. Which leaves us with the big question. In trying to strike that delicate balance, do you think the law gets it right?